It is a privilege for me to be able to introduce Mr. G.V. Prasad, the managing co-chair and managing director of Reddy Labs. Mr. Prasad, when I heard through my friend, Mr. Chokko Valliyappa, a great friend of mine working together, taking his company to Canada for partnerships, when I heard from him that you confirmed your participation on behalf of our organizing committee, I want to say profound thanks to you for joining us. Mr. Bagla mentioned about investment, capital, even the human capital, people capital today goes across the world serving the population around. I am pleased to say I hear my partner Sridhar's son, Dr. Jayant Sridhar, has joined you, a true Canadian, got his early education in Canada, went to Plenary, got his degree from US, worked for Merck, went to Biocon. Now he has come to work under your leadership in your company in Reddy's Lab. It makes us, the true Canadians, feel very proud how the human capital is so important working with the world leading entrepreneurs like you, companies like you, serving healthcare, offering solutions to the global population, healthy human population around the world. I truly want to say how the connection, people connection, be it Chokko Valliyappa, be it Jayant Sridhar, we all will feel proud how the true partnership in Canada and India together can be solving the problems for tomorrow. Mr. Prasad, it's a privilege inviting you to share your thoughts. Mr. Prasad.
Thank you. Thank you so much. It's a big honor for me to be here today. I can see that I am the least qualified person in the panel that you have put up in this session. So following me, you'll have a lot more wisdom. But I'm here to share what a company like ours, which is a pharmaceutical company, can do to solve problems of society. Of course, the purpose of every business, they say, is to make a profit. But I think the real purpose of a business is to find solutions for human problems, and by doing that, make a profit. So while this pandemic has created a very, very different world for all of us, it has put a disproportionate weight on companies like us to accelerate innovation, to bring products to market, to keep patients safe and supplied with critical medical medicines. And hence, there was a huge responsibility on all of us. So I'm very proud of the work that my colleagues, my team of almost 20,000 people across the world have done. And I wanted to share some of their work during this pandemic, how we have responded and created solutions, at least partial solutions to the pandemic, and how we were able to support the medical community and the healthcare systems through our work. Can we have the next slide, please? So as soon as we got hit by the pandemic and we understood what had to be done, our first job was to give clarity to our teams, to help everybody, the 20,000 people that work in Dr. Reddy's, be completely aligned to what the priorities were. And we gave that clarity by saying that our first and foremost responsibility is to keep everybody safe. Keep our colleagues safe, keep the work environment safe, and their families and everybody around us. So that was our first priority. The second priority was to ensure that we continue to supply medicines, because the pandemic necessitates that we must keep everybody healthy, even people who are affected by COVID and those who are not, but they need their medicines. Medicines are essential for survival, so we had to meet our supply chain obligations, our commitments to patients and doctors. That was the second one. The third one is, as a research-based pharmaceutical company driven by our purpose of good health can't wait, we had to bring solutions both to prevent the spread of the disease as well as to treat the disease across the various aspects of this disease. So these were the three priorities, and we communicated this several times, multiple times, to the entire Dr. Reddy's community across the world. Next slide, please. So this slide has actually some of the measures that we took early on, but I have to say that this is evolving so much. As the virus evolves, as the spread evolves, as the number of cases increase, we have to continuously improve what we were doing to ensure a safe workplace, as well as to take care of people who got infected. So we repurposed several of our facilities into COVID centers. We had hotels within our campuses, 1 or 2 hotels. We converted them into COVID hospitals. We put oxygen supplies into these facilities, tied up with hospitals. And in the most recent, this last few weeks, we have a emergencies center which supports employees around the country to find hospitals, to find beds, to find treatment, and all of that. This team works 24/7 and have helped colleagues everywhere, by keeping them safe. And this was a voluntary initiative. It was nobody told them to do this, but my teams were inspired to do this, and they've really made a huge impact by taking care of themselves as well as their colleagues. And I'm really proud of the commitment and passion they've shown in terms of helping people across, both within the company and in the community. Next slide, please. Also, as a healthcare company, I thought we had to play our role in society. When this company was founded, Dr. Reddy, he was himself a very big philanthropist and did a lot of work in the community. And with that spirit of service, many of our colleagues stepped up voluntarily and did a lot of interesting work to support society. When the first wave hit us, we were really focused on seeing what was the need. The need at that time was really to support people's livelihoods and also provide people food and necessities to survive the lockdown. And in that period, we focused on that. We also focused on helping the government through funds as well as medical essentials like PPEs, surgical masks, and all of that. But in the most recent, this spike, we realized that it was not about food, livelihood, or anything, but it was about life itself. We saw that the spike put the whole healthcare system into disarray, and we had to augment all of these. So we chose 3 areas to support society in. We chose setting up and enhancing medical infrastructure for the hospitals. So we set up some step-down hospitals. We are supporting hospitals across the country in expanding their hard infrastructure and providing them equipment such as oxygen concentrators and ventilators and other such hardware. We are also providing free medicines to many people and many hospitals. And finally, we also have our vaccination partnership, which we have brought to India. So this is something that my senior team leads each of these areas, and we have champions, and we are starting to see good impact through this community work. Next slide, please. So as we, as COVID started impacting our operations, we really had to ensure uninterrupted operations. And I'm very proud to say that we didn't even stop our manufacturing for a single day. We continued to work round the clock. We made adjustments. We had to, many of our people got infected. We took care of them, but we also had to make up for, the distancing and all the other special things that we had to do to keep the workplace safe. And in spite of all that, we kept up our productivity. We actually grew last year over the previous year, both in terms of sales, products, and also profits. And we saw some exceptional activity in every geography that we were in. We launched 175 different SKUs, many product approvals, and many filings. And we had to tie up our supplies through the disruptions. Initially, there was a China issue, but that we overcame very fast. And then we had logistical issues. We had flights disruptions, shipping disruptions, huge increase in freight, all of that. But we tackled all of that and ensured that we didn't see any shortages. And through the year, we maintained a very high level of service to all our customers, doctors, patients, and distributors. So this was possible because of the commitment and passion of people, because they were driven by the purpose of the company, and also help of technology. I'm going to talk a little bit about the technology in the next slide. Next slide, please. So as a company, we have, slides are gone, but I can't see the slide. Is the slide visible? Yeah, next slide, please. Sorry for that interruption. Yeah, so we, as a company, Dr. Reddy's always invested in digitization and digital capabilities. And this investment really helped us to move operations to with minimal manpower. We have invested in automation, we have invested in digitalizing all the core processes, and we were able to transition to a work from home for a very large component of our workforce. Of course, manufacturing needed workers on the shop floor. We needed scientists on the labs, but we could minimize interactions and could use the digital capability that we had to full extent. And this helped the organization navigate. And also the whole pandemic accelerated the adoption of digital tools very rapidly because there was no other alternative. Next slide, please. So driven by our purpose of good health can't wait, we focused heavily on finding solutions in the area for treatment, prevention, and various aspects of the disease. In the very first few days, in the first week of the shutdown or the lockdown we introduced a sanitizer because sanitizer disappeared from the market because of the sudden spike in demand. Then we looked at how we would prevent this. And we are working with our Russian collaborator, RDIF, to bring Sputnik V to India. And we are in the first phase of the launch of the product now. We are also working with another product for preventing infection, which is a nasal product. And in the early days, we worked on what we thought would a solution from hydroxychloroquine. Later on, we found that it does not work very well. We tied up with many companies to bring their products to India, which includes American companies, Japanese companies, European companies, and also the defense establishment in India for treating the disease in various aspects. And we still continue to work. We also had a collaboration with a Canadian company called Apili for doing a trial on favipiravir for mild to moderate infection cases. And this trial is coming to an end. So this pandemic has taught us how to collaborate and how to bring solutions rapidly from across the world, from every part of the world. And next slide, please. We were able to, and I'm really grateful to all our collaborators who have moved very rapidly to ensure products are approved within the Indian regulatory system, are made available, technologies were transferred, and voluntary licenses were given. And the speed at which partners tied up was really inspiring to us. And many of these companies waived their IP rights, allowed us to make these products without any royalties back to them, and gave us permission to sell these products across the world among the developing world, among the 178 lesser developed countries. So this kind of collaboration is unprecedented in the industry. Companies giving up their know-how, giving up their IP rights, giving up their revenues to make these products available to as many people as possible in the world in as little time as possible. So it was truly an extraordinary time for the industry. Next slide, please. So here There are some names with whom we collaborated. Apili Therapeutics is from Canada. We work with them to develop favipiravir, Merck Sharp and Dohme for molnupiravir, Lilly for baricitinib. These are all antivirals. We've launched remdesivir under license from Gilead. And of course, the many other companies. We also work with the Defense Research Development Organization in India to develop a product called 2-deoxyglucose, which got emergency approval recently. And so the whole concept of all of us, no one is safe unless all of us are safe, is really seen here. And the intensity and speed of collaboration was unprecedented to me. Next slide, please. We just launched the third vaccine in India. This was also a very inspiring collaboration. This product was developed in Russia with 2 viral vectors and in record time. And the global trials were conducted by them. We conducted the trial in India, navigated the product through the regulatory process, and we've set up the cold chain, which is relatively unique in India, minus 18 degrees centigrade across India. And we have started the soft launch this month, and we hope to play a big role in immunizing a large portion of the Indian citizens with this collaboration with the Russian Direct Investment Fund. Next slide, please. I'll skip the slide. This is about 2-deoxyglucose, which was developed in partnership with DRDO. Favipiravir is again another example of great collaboration. Initially, it was considered a solution for the advanced cases. Then we are now looking at it at early to mild to moderate stages, and it is being used widely in India and many other countries. We tied up with the innovator in Fujifilm in Japan and are doing the trials in North America through Apili. Next slide, please. So the pandemic taught us many things, of course. I think it's taught us that we can do things much, much faster than we normally do. And with great collaboration between government, private sector, and international companies, we can accelerate access to pharmaceuticals across the world, pharmaceuticals, vaccines across the world. And innovation, is really, can be fast-tracked when people work together. A great example of this with the speed with which vaccines were launched for COVID-19. And this is a story which will be, which will be truly, inspirational when the history of this pandemic is written. So thank you very much. I request all of you to stay safe, positive, and we will overcome this crisis. Thank you.
Thank you so very much, Mr. G.V. Prasad, for your very, very insightful presentation. We really enjoyed it. And we're all looking forward to your leadership and your help support as India, overcome from this COVID situation as you're rolling up your Sputnik vaccines as many other. We are looking forward to staying connected. Friends, it gives me an immense pleasure to invite Dr. Randeep Guleria, Director at All India Institute of Medical Sciences. Dr. Guleria is one of the key figures helping India's effort at stemming the pandemic, and his expertise is often sought for understanding and implementing the policies related to COVID-19. Friends, as we all know, that AIIMS was established an institution of national importance to serve as a center of excellence in the medical sciences over 7 decades ago. And today, it is an epicenter of research, patient care, and education. And Dr. Guleria has been serving the institution for the last 2.5 decades or so, with many distinguished accomplishments and contributions in the field of healthcare and education. He's the recipient of many awards, including Padma Shri, and it's a very rare privilege and an absolute honor to have you, sir, with us. Over to you, sir. Thank you.
Thank you very much, Mr. Satish Thakkar. And I'd like to start by thanking the Canada-India Healthcare Summit for inviting me, actually, because I think this is something which is very, very important. And what really has happened is that COVID-19 has put healthcare in the center stage as far as the world is concerned. And it's really made us realize that the world is one village. And like people before me have been saying, that no one is safe unless everyone is safe. And this has also shown that in the world now, we have to start looking at collaborations, whether it be research, whether it be surveillance, finding new treatment strategies. And this can only be done by global partnership, by researchers, by scientists, by epidemiologists coming together, even policymakers coming together. Therefore, I think there is a lot of learning which we've had from this pandemic. And I truly hope and believe that this learning will stretch beyond the pandemic so that we are able to save more lives by really collaborating in different ways. I'll just be giving an overview of what was happening in India and what we at the All India Institute of Medical Sciences did, because this will give you an idea of how hospitals reacted to the pandemic. So our first case came last year on the 30th of January in Kerala. And after that, of course, we had this huge surge of cases. Currently, we have around 2.5 crore cases, and we've had about 2.8 lakh deaths. This is a huge number, and we have the second highest number of documented cases after the US, and the third highest number of documented deaths after US and Brazil. The silver lining is that if you look at this per million deaths, per million population, then both the numbers and the deaths are much lower than many countries. Therefore, what really strikes out is that it's basically the population of a country which also is contributing to this huge number. We've had this huge spike that you can see. The first wave was not that bad, but the second wave really had up to 4 lakh cases per day. But what really troubled us the most was the rate of rise of this wave. This is almost vertical if you have a look at it as compared to the previous wave. And therefore, this caused a huge strain as far as the healthcare structure was concerned, because you did not have that much of a turnover time in terms of being able to discharge patients before the next lot came in, because this second wave was almost like a vertical rise in the number of cases. What caused the second wave? Relaxation of COVID precautions, opening up of schools, theater, gyms, public gatherings. A lot of people felt that now our cases were low, vaccines were being rolled out, and therefore we had got over COVID-19. And this led to a little bit of feeling of sort of relaxation, and COVID appropriate behavior was not followed. And this really caused a lot of indoor and outdoor gatherings, and people were not wearing masks. Those events which had been postponed for a year, like weddings, all started happening. And this combined with the fact that new variants were emerging, not only in India, but across the world, which were highly infectious, really led to the virus spreading very rapidly in our community and leading to this huge surge of cases that we saw. India adopted stringent strategies from lockdown to physical distancing to widespread public education to testing to serosurveillance, and we're now starting a fourth serosurveillance to see what is the positivity rate in our population, and of course a lot of other things, including the vaccines which have already been mentioned. So we very early, there was travel advisory last year in January, and then there were various guidelines which came into place for containment, for surveillance, and also a large amount of corpus was created to really support all of this. The lockdown first happened on 24th of March last year, and we had various phases of unlocking. This gave us time, and we were really grateful for this lockdown because this allowed us to get things in place like PPEs, ventilators, infrastructures like ICU beds, COVID care centers for mild cases, COVID hospitals for more moderate to severe cases in COVID ICUs, which became standalone centers, and I'll come to that. In the second wave that we've seen now, we looked at a policy of not having a national lockdown, but developing containment zones which were more regional. And they looked at various strategies, like if you had your positivity rate more than 10%, or you had more than 60% of your COVID beds which were full, you should have an area where you could have containment and aggressively follow a policy of testing, tracking, treating, and isolating. Our virology our testing really picked up when we started in March. We were able to isolate the virus by the National Institute of Virology, which is under the Indian Council of Medical Research. We had only 15 labs when we started, and these were part of the ICMR network, ICMR flu network. We have now more than 2,500 labs which are doing testing for COVID-19. Yesterday, we did more than 2 million tests in a day. And India had made local kits which were validated by ICMR. Early, we started what was known as INSAGOG, which is a consortium of 10 laboratories which are doing gene sequencing to pick up new variants which may be emerging in our country. And we've had the Indian variant, which has now been reported, which has been picked up by this INSAGOG, which is 10 laboratories. And this is also being expanded. We at the All Institute of Medical Sciences are also now becoming part of INSAGOG to really take more samples for gene sequencing and to be able to understand how variants are emerging in our country and how we can tackle them, both in terms of immune escape mechanism, infectivity, and causing more deaths. Vaccine has already been touched. We are now, India has been the largest producer of vaccines globally. And very early, Serum Institute of India, Bharat Biotech, and now Sputnik with Dr. Reddy's laboratory have got emergency use authorization. Vaccines from abroad have also been approved, and therefore we are looking at having a good supply of vaccine to really cover our entire population, which would mean that we would need around 2 billion doses at least, because there are 2 shots for each vaccine. We started off with a shortage of PPEs and equipment, but now we are actually exporting PPEs, and a large number of local manufacturers are making ventilators. So India has now been able to export both PPEs, personal protection equipment, and the N95 masks. Infrastructure and training was also looked at. IEC was prepared, and I'll come to that also. And media played a very, very constructive role as far as India's response was concerned. So in the second wave, we looked at COVID appropriate behavior more aggressively, because that was something which had not been done. Vaccination drive was upgraded, which I've already mentioned. We did limited lockdowns in areas, especially at hotspots, and a lot of support was given for new therapeutics and preventive strategies. Lockdown helped. This is how New Delhi fared. And as you can see, we in Delhi also had a spike. But the lockdown, which was introduced in Delhi, and we still have a lockdown, the cases have come down dramatically. And a positivity rate, which had gone up to almost 25 to 30%, is now less than 10%. And we have now around less than 5,000 cases a day, which had gone up to almost 25 to 30,000 a day. So this has helped, and this is happening in many parts of India. The pandemic is moving in our country. It's moved more towards the south and towards the eastern part. So there is an increasing number of cases being seen in states like Tamil Nadu, in Karnataka, and also in the northeastern part of our country. Coming to what we did at the All India Institute of Medical Sciences, just to give you a flavor of what hospitals were doing, we were involved in the National Task Force, which were making guidelines for the country. We were also part of the Empowered Group set up by the Prime Minister's office to develop strategies for the country. And there were a number of empowered groups set up, which was multi-sectorial, to really get everyone together, whether it be oxygen, whether it be looking at future forecasts, whether it be preparing for COVID care centers. And also, I was the chair of the clinical research group to look at research as part of the Indian Council of Medical Research. The key challenges were protection of our healthcare workers, motivating our healthcare workers, and this is a big task now because the pandemic is more than a year old, and healthcare workers have given up a lot of their, let's say, leisure time and have been working tirelessly for more than a year. There was also a need to increase the intensive care beds, teach everyone about COVID-19 related protocols. A lot of healthcare workers came from other departments. They were not intensivists. They were not people who are looking at infectious diseases. And then we had also responsibility of mentoring and capacity building of other institutes across the country, which we've done in the form of various activities, including supporting and mentoring to build up labs. We are now looking at mentoring various centers of excellence in each state and each region to develop strategies to really provide care in rural India, because we feel that that is one area where the pandemic is going to move. And therefore, to train doctors to diagnose and treat in rural India is going to be another challenge that we have. So we've had a national task force, which I formed way back last year in February. Various subcommittees were formed to see that there was smooth flow as far as hospital requirements was concerned. And even till now, I have this daily meeting with our faculty members, our nursing officers, our residents, our OT technicians. And we discussed things that keep emerging. Now we have a new problem of a fungal infection, mucormycosis. We have almost 80 to 90 patients admitted with this infection. So we need antifungal drugs. We need to create a new ward for them. So we've been having new and new problems over the last 1 year. And these meetings help to really resolve issues and come to a common platform. So we converted our National Cancer Institute, which is a 700-bedded hospital dedicated for cancer, into a COVID care hospital and a COVID care center. We converted a trauma center because trauma had come down during the lockdown also into a COVID hospital. Our emergency triage area was expanded, and we were able to create dedicated 1,710 beds for COVID and almost 250 ICU beds as far as COVID is concerned. In the first peak and also in the second peak, we had up to 800 to 900 patients admitted, and they were being treated at our hospital with the same degree of resources that we had in terms of manpower. This is our National Cancer Hospital in Jhajjar, which is around 50 kilometers from our main hospital. This has the hospital at one end, the OPD and the research and teaching block. This is the photograph from the ground, and you can see the hospital block at the end. And on the left is the building which is coming up, which is the Vishram Sadan, the guest house, which is being supported by Infosys for the patients who would come subsequently for daycare, for chemotherapy, and for their attendants to stay. This is a trauma center, which was also converted into around a 260-bedded COVID center, and the burns and plastics hospital behind it was also converted into a COVID hospital during the surge that we saw during the second peak. So a large number of things were done, from nodal officers to transportation to various other activities like accommodation being created for doctors to stay nearby, and also looking at ways to provide support in terms of hiring buses for our staff itself. We also were involved in testing, and this was something we did aggressively. RT-PCR, CBNAT, and the rapid antigen test was something that we really got sort of validated very early. Various programs and protocols were made, which were then became part of the national protocol. And this was something that we are proud of, and we continue to do that. There are new guidelines which emerge every few days because new evidence emerges, and it's important to stay in touch because, as was mentioned, we started off with hydroxychloroquine and moved away from that, and now are looking at different treatment strategies as newer and newer therapies emerge. We also really aggressively looked at teleconsultation because we realized that two things were there. One was that there was an issue of patients who were being managed at home in terms of home isolation. And secondly, non-COVID care should not suffer. So patients with heart disease, patients with hypertension, patients who are diabetic, they were provided teleconsultations because they were worried and scared to come to the hospital because of the fear of getting COVID. So this is something that we've been doing aggressively. We converted our guest house into the contact facility, the COVID-19 National Teleconsultation. And we did this in the guest house so that the residents, the faculty, the undergraduate students who were volunteers could stay there 24/7 and also have a running mess so that they could provide the consultations throughout the day and on weekends also. We also have now almost 20,000 patients that we've treated. And we have been doing dialysis also because there were very few centers which were doing dialysis for COVID-19 positive patients. And we've done more than 1,000 dialysis for more than 1,000 patients. Various webinars, teaching modules were created. We realized very early that we have to train our healthcare workers because infection control is very, very important. And we've trained almost 33,000 of our own employees and used our Saral platform, which we used for teaching undergraduates and postgraduates, as a platform for teaching our doctors, interns, nursing officer, OT attendants on how to really manage COVID-19 and how to protect themselves as far as this is concerned. Many programs were started. We started a national clinical excellence program, which we are doing regularly and to build up infrastructure in the country. I've been having every Tuesday and Friday what we call national EICUs. I've probably interacted with more than 500 hospitals in the country and discuss treatment protocols and try to make standardized treatment protocols because many areas people are not really, doctors are not aware of how exactly COVID-19 should be treated. We've done capacity building from COVID-19 testing, and we've made sure that every medical college in the country, whether it's in the government sector or in the private sector, has a COVID testing laboratory, an RT-PCR lab, and this was something that was followed. We also started doing national clinical grand rounds, and we have done this at a national level, but also at an international level. Also, training for SAARC countries, our neighboring countries, was also done with good response from Nepal, from the Maldives, and we were able to really get them on board. Research is something that AIIMS is very, very conscious about, and this is something that we would look at collaborating with Canada or Canadian institutes also. I basically announced that we will support research way back in February last year and created a corpus in the institute where we said we will give money rather than waiting for it to come from outside. And we had almost 63 research proposals, which we accepted out of 178, which was submitted in March last year. More than 200 papers have been published, and this has helped in really making guidelines. And 50% of these are interinstitutional collaboration. We have an MOU with IIT Delhi, with IGIB, and even University College London, and we are doing collaborative research with them. And therefore, I look forward to really seeing how we could do this with various institutes in Canada. Various education booklets were made. We made a COVID portal, and this was all the activities that we did. This is a booklet which we released last year. Be careful, not fearful, as far as COVID-19 is concerned. We have a COVID-19 platform. We've made more than 50 videos, which is like management of COVID-19 and the elderly, how to wear your mask properly, the issues of social stigma, and various other things are all available on our website and also on the Ministry of Health and Family Welfare website. Various teaching webinars were also made, which really addressed issues like mental health issues, antenatal care, yoga, which could be very useful as far as managing stress in the times of COVID is concerned, and various other topics were also discussed. So this is what I would like to say. Thank you very much.
Thank you. Thank you.
I'm sorry if I was a little abrupt. I didn't know how much time I had, so I really edited a few slides, so I'm sorry for that.
Thank you, Dr. Guleria. It's quite insightful of what India is accomplishing in such a short time with the COVID. Dr. Guleria, just to let you know, at one point in time, Canadian Institutes for Health Research had a collaboration with ICMR. During my time when I was one of the executives of CIHR, we had the collaboration, and it is time for us to revive that collaboration. Thank you for your talk. And our next speaker is a good friend, and she is a career scientist, and she has risen from as a research scholar now to the Vice President of the National Research Council of Canada, and she is in charge of life science portfolio, and she has done substantial amount of work on vaccine developments. And not only that, Lakshmi has been extremely helpful for us to put together this conference. Thank you very much, Lakshmi. And over to you, and we look forward to your amazing talk.
Thank you very much for inviting me to this workshop today. That's my great pleasure. I've got, first of all, my heart goes out to everybody in India. I have close family and friends that are impacted by the COVID-19, like many of you do as well. And I do hope that we will all come out of this stronger. But it's also very heartwarming to see my esteemed colleagues in this panel present all of the effort and the resilience that India has. And in many areas of the response to COVID, I think India has been an example, whether it be in vaccine manufacturing or being in the way ICMR has been able to have so many different labs doing testing and serology testing. So I think there's a lot of opportunity here for us to not only work together now, but to continue to strengthen relationships and to build together what the future resilience in life sciences will look like. So I hope the next few days will be very interesting. And I'm also looking forward to hearing many of the talks over the next few days to understand that. Next slide, please. So as Dr. Chokalingam mentioned, I come from the National Research Council of India. And as he said, my foundations are in India. I actually did my PhD in India at New Delhi at the National Institute of Immunology. And that was really my springboard. And I probably left India at a time when science was, an investment in science was just about beginning. So there was not very many opportunities for, immunology at the time. But now, of course, it's a totally different story. So I really pride in the foundation I received and what has helped me grow in the last 25 years in Canada. And of course, this is a beautiful country where we can grow in science, grow in collaboration, and really reach out around the world. The National Research Council of Canada is actually Canada's largest intramural research arm. We have about 5,000 employees spread across the country at many different sites. We have 14 research centers that deliver science and technology in various sectors, life sciences being one of them, but also in engineering, in construction, in IT. And I think the uniqueness of NRC is that we can actually very quickly bring together a cross-sectorial team to address and solve any problem. And this was the demonstration that we've been able to do for COVID-19 over the past year. We also have another arm of NRC, which is quite relevant for many of the participants here, which is called the Industrial Research Assistantship Program. This is a granting program for small, medium-sized enterprise. As we heard, SME community is growing not only in India, but also in Canada. And so the IRAP program does offer opportunities to bridge the investment in SME community and help them scale and grow in various sectors. So that program also operates coast to coast at various regions through local technology advisors that IRAP has. So next slide. So when COVID hit last year, like we have heard the theme across many organizations, for NRC as well, it was very clear that we had to pivot. And we had to pivot in a way not only to deliver science and technology solutions, but also to keep our people safe and the community safe. So those were the three themes under which we operated very quickly. In fact, I participated in the WHO Blueprint meeting in February, when just before the pandemic was announced. And as I was flying back, the pandemic was announced, and it was very clear that the speed with which we will have to pivot and the speed with which we all will have to get ready was going to be very important. So within the NRC, what we did was essentially divide our effort along three major pillars of protecting people, protecting community, and protecting our clients that were working with us, because we do work a lot with small and medium-sized enterprises, and these were also facing quite a bit of struggle. So in order to do that, we had about 5 themes under which we organized ourselves. We firstly launched what we call as a pandemic response challenge program. This allowed our intramural research to be pivoting and directing towards some major questions and solutions we had to bring forth. We looked at vaccine biomanufacturing at the time. Unlike India, India's, of course, has got a very strong capacity for biomanufacturing. Canada did not have that. So obviously we had to look at partnerships for not only advancing a pipeline of Canadian early innovation, but also partnerships with other players to see how we prepare for the future in biomanufacturing. We did a lot of community support, and of course our IRAP, or Industrial Research Assistantship Program, brought together many investment programs specifically targeted at SMEs to promote COVID solutions. In total, over the last year, NRC has responded to over 1,000 requests of technical advice and short-term support to both academic sector as well as university and other government departments. Next slide. So a sample of what IRAP has done, and this is more targeted at early stage SME, because we have other programs in Canada through our Industry and Science and Economic Development Ministry called ICED, which is more targeted to more advanced stage products. But what IRAP did in NRC was more focusing on early stage innovation. So we invested about 150 million to vaccines and therapeutics development to nurture a pipeline of this industry in Canada. And stage 1 funding was provided to about 6 different companies. And of course, this is being continuously evaluated, not only for new investment, but also to provide the second stage of funding as these companies progress. Next slide. On the intramural side, as I mentioned, what we did is we organized ourselves to launch the Pandemic Response Challenge Program. The Challenge Program is a tool at the NRC where we're quickly able to, not only coordinate our intramural effort, but also collaborate with the ecosystem, whether it be academia or other government departments or industry, on very mission-oriented research. So we had this tool available to us, and so we quickly organized it around the pandemic, and we addressed 4 key areas: diagnostics, biologics, both vaccines and therapeutics, digital healthcare, as well as AI data analytics. And so under each one of these 4 pillars, from detect to protect, treat and prevent, virtual care and analysis, and transform and adapt, we had launched a number of different projects. And over the next few slides, I'll give you a sample of the projects that we launched, and many of them are still ongoing in order to really bring impact in this area. Next slide. So rapid detection and diagnosis, under this pillar, the goal for us was to demonstrate devices, platforms, consumable and reagents. Like many other countries, as we have heard, very quickly in the early days of the pandemic, there was a supply chain issue, there was a shortage of reagents. So we had to really quickly, think about more novel ways of accessing these devices. And we also wanted to look at disruptive technology for the future, because one was to address immediately, but for the future, we wanted to not be in a similar situation, and actually be more prepared with technologies that could be potentially rolled out at site, point of care, and maybe even ease of use in the absence of trained medical personnel. So one of the innovative projects we're working on is a chewable diagnostic. So developing a safe saliva-based diagnostic platform. And this is we are doing with University of Toronto. Another innovative area of disruptive technology we are actually working on is lab on a chip using microfluidics. And NRC has a very long-standing expertise in microfluidics and power blade technologies. So we've now pivoting that to actually prepare samples for COVID-19 genome sequencing. And just like we've heard in India and Canada, we have a number of consortiums. CanCogen is one that was funded by CIHR as well as by Genome Canada, which is looking at the genome sequencing across with all of the strains that are circulating. And so we are working with them to see in the next iteration, can this genome sequencing be done on site in the field through this power blade microfluidic technology. Next slide. In our vaccines and therapeutics pillar, this I would say was our largest pillar in terms of our immediate pivot and the way we organized ourselves. And the reason for this is that the NRC has had a long-standing history in vaccine development. For many of you who may not know, the meningitis vaccine was actually developed by the NRC. And there are many other, and the very first glycoconjugate vaccine technology, the patent came out of the NRC. So there was very deep expertise in vaccine development. And we also have a lot of capacity in process development and biomanufacturing, which will come in a minute. So in this case, our aim was to work with partners. And in Canada, for example, we worked with certain partners that were having early stage. There are actually 2 vaccine partners that we have enabled to enter clinical trials. So one is a company, VBI, which later on, there is a talk by VBI in the seminar, in this symposium. Tomorrow, I believe, as well as Vido as will also be presenting, where again, we enable them to quickly do a number of different things like preclinical testing, because we were actually a reference laboratory for level 3 containment in order to do the virus testing as well as animal model testing. So we could enable these companies, as well as our biomanufacturing could enable them put together the manufacturing process required in order to prepare their clinical samples. A second aspect we did was the spike antigen production, and I'll talk to you a little bit detail because we immediately created some reference standards, and there's a great opportunity in that material that we've provided. Next slide. In our pillar 3 in digital patient care and pandemic analytics, our medical devices research center is actually got deep expertise in this area in terms of artificial intelligence and virtual care. So we are organized ourselves to work on a touchless sensor for vital signs. And also with the University of Waterloo, we are working on machine learning and to actually deduce more algorithmic data from X-rays and CT scans and ultrasounds, because as you know, there's this whole phenomenon called COVID long haul, where patients who recover are still having other issues, vascular issues, as well as other comorbidity issues that have arisen and continue to be chronic. So I think using this type of artificial intelligence and machine learning, we hope to be able to be better able to predict the prognosis for patients who have been affected with COVID. Next slide. And then on our last pillar, which was essentially focusing on enabling immediate adaptive responses to the ecosystem. An example of this was that very early in the pandemic, Canada realized that actually the reagents needed to run diagnostic tests was in big shortage. And I think this was the same case globally as well. So we had to be, really grow our own capacity to do that. So NRC actually reorganized the laboratory in our pilot plant to be able to prepare all of the different reagents needed for diagnostic testings. And to date, we have produced something like 60,000 liters of diagnostic reagents, which have enabled over 30 million kits to be used in Canada with these homegrown reagents. Another example was early on when the PPE shortage was very pronounced and we could not wait for masks to be coming from elsewhere. We looked at the possibility of sterilization of N95 masks. And again, very quickly, we set up a pilot prototype lab at the NRC, working with a company called CleanWorks to be able to repurpose and decontaminated N95 masks and restoring the supply in Canada. Next slide. The last few slides, I want to focus on one of our major research centers at the NRC, the Human Health Therapeutics Research Centers, which is really my home research center. And this is the largest R&D team in Canada that enables discovery and development of biologic medicine. So we are about 350 scientists that are solely working on vaccines and antibody biologics. And the strength of this research center is the enabling technologies that we have developed over the years. We have, for example, a number of biomanufacturing cell lines and viral vector systems that are platform technologies that can be pivoted very quickly. And also the single domain antibodies and monoclonal antibody production is also something that we do routinely, and quite extensive portfolio of these antibody that we already have in our portfolio. So using some of these enabling technologies, we are able to focus on some key areas of application. So biotherapeutics, vaccines, cell and gene therapy products. And we work extensively with the Canadian SME community as well as international partners. And over just since 2012, our R&D team has enabled taking discovery innovation all the way to clinical trial for about 11 different products of these vaccines, biologics, and therapeutics. And so far, prior to the pandemic, what we would do is that we would bring a lead candidate through selection and optimization for product development and process development. And then we would work with a GMP manufacturer to transfer the GMP manufacturing process. But actually, one of the things the pandemic taught us that could be a valley of death. And so we are actually in the process of completing our own GMP production capacity so that in the future, even that tech transfer can be enabled more seamlessly to move products into clinical trials. Next slide. One of the strong capacities our research center has that we have pilot plant. And often in GMP laboratories, it's difficult to do process development because it's very costly, it's very cumbersome to apply GMP until you have a good, robust process that has already been developed for a product. And that's where our team comes in, because we have pilot plant in R&D, which kind of works like a GMP-like, and with all the good laboratory practices in place. And so we can immediately scale up process. For microbial, for example, we can scale up to 1,500 liters. And for the mammalian cell production, we can go up to 500 liters. And not only that, our team over the years has developed many proprietary mammalian expression cell lines. So for example, we have our own proprietary HEK cell line, the CHO cell line, the Vero cell line. And for those of you who are familiar in this field will know that these are being the cell lines that have been used to produce many of the vaccines, particularly the viral vector vaccines and the protein-based vaccines. So we can really work with partners to enable that by matching our assets with partners' assets and together leveraging innovation. Next slide. And the one other example that I want to highlight is the way NRC pivoted to do the spike protein production. For those of you, again, who are on the science side will know how difficult it is to produce the spike protein. It's a very complex, very large protein that is essentially decorates the entire coronavirus. And it was it's been the heart of many of the vaccines, because most of the vaccines are trying to induce an immune response to the spike protein. What that meant is that we need good tools and reagents to actually test the immunity to spike protein, either in individuals who have been infected or during vaccine development. And so very early on, NRC utilized our own platforms to produce the spike protein. And I'm very proud to say that we actually have an NRC spike protein reference standard that can actually be purchased for a very nominal fee from our web store, which comes with full characterization data as to how the spike protein has been produced and all of the characteristics of the vial that you receive for your own analysis. And we have signed about 80 material transfer agreements globally with both academic and industry to enable various other groups to utilize these materials in their diagnostic kits as well as in serology testing. In fact, in Canada, we do have an immunity task force that is looking at serology testing nationwide, and more than 50% of the kits that they're using for serology testing utilize both the spike antigen as well as antibodies that NRC produced and qualified for use in these diagnostic tests. Next slide. And lastly, I want to talk about GMP production. So early on, Canada realized that we had a huge gap in biomanufacturing in Canada. Unfortunately, even though Canada has been a leader in vaccine development in about 2 decades ago, a lot of that capacity in biomanufacturing had exited and had moved on into private industry and was not readily available for pivoting during a pandemic. So Canada has made great investments in biomanufacturing and continues to do so. Many of you may have seen more recent announcements in the private sector as well. But NRC was tasked in the spring last year to build 2 facilities. First is a clinical trial material facility to be able to enable clinical production of a pipeline. And second was a biologics manufacturing facility, which would enable the later stage of manufacturing for authorized product. So starting out, we broke ground for this facility in July last year in Montreal at our research center. And again, many of you who have built GMP facilities or know how vaccine production facilities have to be stood up, you know that this can take time. It can take more than 2 years or even more, depending upon all the qualification that is required. And we're very proud to say that this facility is more or less ending its construction completion. And we hope to be able to, later this year by December, moving into the qualification and engineering runs, so as to have the capacity within Government of Canada to produce vaccine doses, about 2 million doses at this facility starting early next year. So this has been, I think, a remarkable effort of scientists at the NRC and the investment, timely investment by the government that has enabled us to do that. We will match this in parallel with a second stream of a clinical trial material facility, which will really be a feeder facility, because you want to, again, do the process development from R&D to clinical trial and to manufacturing. So at the end of this, we'll be a much more resilient organization, having an end-to-end solution from early R&D all the way to late-stage manufacturing. Next slide. So with that, I'd like to conclude to say that very much like the stories we have heard from Dr. Reddy's Laboratories and All India Medical Institute and many other organizations that we will hear at this symposium, the NRC, as Canada's largest intramural science and technology organization, did really pivot into mission-oriented solutions for the pandemic, both in vaccine biomanufacturing, but also a number of other community support and industrial assistantship programs. And this is not new for the NRC. NRC is 105 years old. And if you look at the history of NRC, whether it was World War I or World War II, or whether it was during any crisis, the government has tapped on the NRC, and NRC has risen to the challenge and been able to support that. And we do this because we do truly believe collaboration and innovation go hand in hand. And so we collaborate for innovation, both nationally, but also internationally. And we are structured to do that in a very diligent fashion. So I look forward to opportunities to collaborate with many different Indian colleagues over the coming years. Thank you.
Thank you, Dr. Lakshmi. Now I'll hand over to Dr. Lakshmanan to introduce the next speaker.
Well, first, I want to thank Dr. Lakshmi Krishnan for joining us with the conference. Thank you very much, Lakshmi. Thank you for joining. It now is my privilege to introduce our Minister, Honorable Anita Anand, Minister for Public Services and Procurement, Government of Canada. Friends, about a year back, when I requested our minister to help us and join us for this conference in front of Lord Vishnu, celebrating Dr. Dubey's 80th birthday, Minister Anita Anand spontaneously said, Lakshman, I'll do my best to come and join. I see her every day. She doesn't see me every day. She appears on TV with our Prime Minister, helping the country, addressing the issue of COVID, diligently, point by point, the way she responds. We all feel very proud. As a true Canadian myself, and Minister Anand, Anita Anand, a true Canadian, but we both have a common heritage. We both can claim we both come from South India. In India, we have a common connection. So proud of you, Minister Anand. I just saw Lakshmi presenting a few minutes back. See the Tamil world going across the world, addressing the issues that we need. The global village that we live in is phenomenally opportunistic for all the global citizens to rise above for the occasion and help the global citizens. Minister Anand, we are truly proud that you are able to come and join with you. The demand on time that you have, you still are giving us time. Thank you very much for coming and joining. Thank you.
Thank you so much, Lucky. Namaste, and namaste, everyone. I see the Consul General Apurva Srivastava there. Namaste, Ji. And I would like to thank the CIF and Satish Thakkar as well. Namaste. It's just wonderful to be back with you. And Lucky's right. I have a great affection for this group of people, and of course for the discussion today relating to Canada's effort to combat COVID-19. And I thought I would just take a few moments to mention from a federal government standpoint what we have done in the area of procurement and the provision of supplies to Canada. And I will also mention the importance that India has played in terms of our relationship, as well as some of the efforts that we are making as a federal government to ensure that India has what it needs to combat this wave of COVID-19. But let me begin by talking about the procurement effort. At the beginning of the pandemic, I saw us in the government as climbing the first mountain, I call it, and that is in the procurement of personal protective equipment. And to respond to the needs of frontline healthcare workers across this country, my department procured 2.7 billion items of personal protective equipment, and we've distributed to the provinces and territories over 1.5 billion items of PPE, face shields, masks, N95s, gowns, gloves, and the list goes on. And that was a very intense period where we were procuring these items from international and domestic sources. And it continues to be an important aspect of our response to the COVID-19 pandemic. In fact, we procured so much PPE that we had to lease additional warehouse space in order to house this PPE. And then we moved to the second mountain of the pandemic, and that is the procurement of rapid tests. We procured 43 million rapid tests, and about 24 million of those tests have been distributed to the provinces and territories. And that is an ongoing aspect of combating the pandemic. That is, we cannot put all our eggs in the vaccine basket. We need to pay attention to public health measures across the board, including screening and testing. And then the third mountain and the steepest mountain has been the vaccine procurements. We put in place 7 bilateral agreements last summer, followed by an additional agreement with the Serum Institute of India for 2 million doses of the Covishield vaccine. And we began to receive those doses in December ahead of most other countries in the world. At the current time, we have had delivered to Canada 22.5 million doses. That's distributed to the provinces and territories already. We'll have 25 million doses of vaccine in the country by the end of this week. 19 million doses have been administered in Canada. 57% of people over the age of 16 in this country have had 1 dose, and we are en route to passing the United States in terms of percentage of the population that has had 1 dose of vaccine. All that to say that our work in procurement isn't done. We still have to make sure that we watch the supply chains carefully. We all saw that there was a fire at the Serum Institute. There are problems at the Emergent plant in Baltimore affecting AZ and J&J doses. There are supply chain issues that have affected other suppliers. And so that means that we have to be vigilant. We need to make sure that the vaccines keep coming to this country. It is not something that we can take our eye off the ball for one moment. And so that's the work that I do every day. Negotiate with suppliers, make sure that they're delivering to Canada, and also to accelerate doses from 1 quarter to an earlier quarter. So I've already worked with my team to accelerate 28 million doses to earlier parts of the year. So that is on our vaccine procurements and deliveries, and that is going well, but we need to be vigilant. In addition to vaccines for now, we also need to make sure we're planning for 2022, 23, 24, in light of the strong possibility that boosters are going to be necessary and potentially annual vaccines. So we've signed a deal with Pfizer for 65 million vaccines to be provided over 2022 and 2023, and options on what is needed in 24. So we will continue to make sure that we bring vaccines into this country from multiple diverse sources. Our portfolio is very diverse in the sense that we are able to draw on various sources of supply, Pfizer, Moderna, AstraZeneca, and J&J have all been approved by Health Canada. So that's on the vaccine procurement piece for the government of Canada. I'll just speak briefly before concluding about India and the importance of India for me personally and for our government. My father is Tamil, as Lucky pointed out, and my mother was Punjabi. And they met in the 50s and got married in England after meeting in Ireland. And they lived in India and Nigeria before immigrating to Canada, where I was born with my two sisters. One of my sisters was born in Nigeria, actually. And I'll just say that we were raised always to pray, to do puja, to worship Lord Krishna, to ensure that we are reading the Bhagavad Gita every day. And that remains a part of my philosophy and my everyday operation. So there's no part of me that isn't wedded to the country of India, because my parents and my family are all from, even though various parts of India, but my mother sung Jana Gana Mana to me every single night before I fell asleep. And I love the national anthem so much. So I'll just say that when we saw, first of all, when we were able to do a deal with the Serum Institute of India, that was an extremely moving time for me as minister to be able to do a deal with a company in India for the provision of vaccines. And we received 500,000 of those Covishield vaccines. And now that India is in a very, very difficult spot, I advocated within government for us to do more to help India. So we as a government donated $10 million through the Canadian Red Cross. And we also ensured that we were sending supplies to India, remdesivir, 350 ventilators and oxygenators as well. And we will continue across government to support India. My colleagues, Karina Gould and Patty Haidu and our Prime Minister are very committed to the bilateral relationship, but also to ensuring that we're doing whatever we can for India. And so I'll just stop there, G, and thank you so much for having me here and letting me be part of this wonderful, wonderful conference where we're discussing such important issues to our country. Namaste. Om Shanti, Shanti, Shanti.
Thank you very much, Minister. Friends, just before coming here, our minister had to attend a meeting with the Prime Minister of Canada. With all the pressure that she has on her time, she still managed to come and join us and share her thoughts. Very, very kind of you. We want to thank you on behalf of the organizing committee and all of us. Continue doing what you're doing. Give us your best and sharing your thoughts and leadership with our Prime Minister, serving our country, living in the global village, and solving the challenges that we have, and together as a global citizens, helping our country, Canada, as well as our Mathrubhumi, India, and then of course the global village. Thank you very much, Minister. Thanks for joining. God bless. Thank you. Thank you.
Namaste and namaskar and dhanyavad. Thank you so much. And I look forward to the times that we can be in person together and eat some good food together and share some joy. So thank you so much and take care, everyone. All my love and all my best.
Thank you. Shall we invite Professor Oh, thanks, Milosh. Well, the relationship between CIF and Milosh is not happening because of the conference. We two together have been working. We two have been working together for the past several years, creating opportunities, creating partnerships, partnerships between India and Canada, whether it is universities, hospitals, or engineering companies, manufacturing companies, not alone working in the field of science, but also helping each other in technology development and creating jobs and opportunities. Milosh, we are very proud. The best in Canada, the fourth best in the world, is able to work together with Canada-India Foundation. We are very thankful for your guidance and support for Canada-India Foundation. We are thankful that you are able to come and join us today and helping us with our award program and the endowment. Be together in this journey. We are together to serve the communities. Be in Canada-India Foundation. We want to say thanks to University Health Network and your leadership and KITE program. Milosh, I now will request you to come and share your thoughts as director of KITE program, as director at the UHN, vice president at UHN. God bless. Milosh.
Thank you, Lucky. It has been a privilege working with you. We've been doing this for a couple of years now, since the first Canada-India Health Summit and before that. And today, the presentation that I will have, I will share some of the successes that we had together. I think this partnership with Canada-India Foundation has been great privilege for KITE and UHN, and we are delighted to be partners. And we're really grateful to Consulate General and FICCI, and of course, Canada Foundation for creating this summit and giving us an opportunity to be partners in it. If you want, I can share my slides and we can start from there. Just bear with me for one moment. Okay, and I just want to, just one more moment. I'm just trying to share my sound. Okay, here it is. Good. So, excuse me. The presentation today that I have is actually trying to showcase some of the really exciting successes we had with partnership with India. And before I start, I need to tell you that I have a conflict of interest that I'm a shareholder in company Mindtech. Has no bearing on this presentation today, but you need to know about it. So why do we want to partner with India? Besides, having a privilege to work with Lucky and the team that he's bringing to us, there are many really good and exceptional reasons for that. So if you look from the Canada's healthcare challenges perspective, there are a number of things which are totally matching our challenges and the challenges that exist in India. Aging population, although in India this is not a prevalent problem, but the number of aging citizens in India is tremendous. And we both societies need help with that. Second, as some of my prior presenters and those who are coming in after me and tomorrow, affordable prescription drugs is a big issue for us. KITE is not in that space, but that's a big thing for India and Canada. Health innovation is very important. Managing large population, managing population at the distance requires innovation, requires a cost-effective solutions, and many of them are not available today, and we need to discover them and create them. And in Canada, what is happening, we have prevalence of chronic diseases. When you look at the prevalence of diseases in India, it's a little bit different distribution, but the chronic diseases that are really affecting Canada, like cardiac, cardiac events, strokes, and dementia and such, are actually the similar type of problems that are facing India as well. So what we have also in common is we need to deliver high quality care to remote and areas which have less access to that, or we have difficult time accessing those areas. And to do that, we need actually to move to more kind of innovative ways of doing it, like telemedicine and emerging, Internet of Things technologies. Now, COVID, which is so disruptive for both our societies, has actually pushed telemedicine in the front of this battle. But this is just the beginning. Telemedicine is something that needs to evolve and grow as we go forward. And as this is happening, the access to patients' data has to be arranged such that everybody in the circle of care should have access to certain data and components of the data to be able to manage the patient. Other thing which I personally think is very important, not many people have been talking about it, but is critical, and our prior director, Jeff Fernie, has been focusing on that a lot, is prevention. If we can prevent events from happening, that's way more cost effective than actually dealing with the problem in acute or subacute phases of care. And one thing which is also becoming very clear as the population is aging, that the advanced rehabilitation interventions are needed. And so when you look at India and Canada opportunities, one of the things that are critical, or there's opportunities for both of us, is actually to grow rehab programs. And you know, I think that creating rehab programs in India presents tremendous growth opportunities. And I'll tell you about one of those opportunities that we're working on. The other thing which should not be neglected at all, India has an excellent educational system. So when you look at the CIHS students and scientists, many of them come from India. And the reason is very simple. It's really high quality talent that is coming from India. And I think we could work jointly to harness that talent towards helping people who are aging and who need care. The third thing that I personally think is exciting is Jugaad culture, you know, frugal innovation, frugal engineering, and hacking. This is now formal way of design in engineering. It's taught in some progressive schools. And I think Canadians and CIHS can benefit from that knowledge and that style of working and solutions. And finally, and you will see in a minute why this is important for us, India has some world-class performing industries such as IT industry and textiles. We can tremendously benefit in having partnerships in this space. So what is our vision? How do we see dealing with aging population and people with disabilities? We believe that you need to monitor patient continuously. Right now, if you want to check what's happening with the patient will come to a hospital, and for a very short period of time, you will take a couple of measures and you'll kind of try to identify what's going on with the patient. The reality is, usually at that time, the picture is not necessarily correct. So you need to monitor the patient at home, at their workplace and leisure activities. And not only monitor, you need to deliver the care in those settings. Now, as you do that, you're essentially creating an opportunity for timely access to medical doctors, to therapists, nurses, psychologists, dietitians, and everybody else who is in a circle of care. Having ability to do these things seamlessly could dramatically change the way how we treat patients as we go forward. An element that will really sparkle this is actually advanced decision-making algorithms, such as artificial intelligence, that will take a lot of decision-making and automate it based on these measurements. And I'll give you an example in a minute. And the final point is, or fifth point is, these technologies have to be zero effort technologies. As Alex Michalidis, who's going to chair a session later on, will probably talk about it. You want technologies that do not have burden, or you don't have an obstacle to adopting them and using them. So the proposed solution that we have at CIHS is that you should be able to put, because of the evolution of the technology and new discoveries that we have, many of the sensors and systems for monitoring and treating patients could be integrated into garments, in everyday t-shirts, socks, leggings, and these type of technologies. Why is this relevant? For example, if you have a person with diabetes today, that person will have to go to the hospital to consult with, with a cardiologist, with a family doctor, with a dietitian, diabetes educator, exercise physiologist, and whatnot. Some of this can be done through telemedicine, but essentially that person has to make this 4, 5, 6 trips and multiple of those trips in order to get a particular portfolio of what they should be doing, which medication they should be taking in order to manage their health. What we are proposing is actually to take the garment that the person is wearing every day and enable that garment to monitor the sugar in the blood, to monitor cardiovascular function, to monitor breathing and movement and exercise of the patient and activity of the patient. Feed that into the cloud, and the cloud has a rule-based or AI type of technology that synthesizes the diabetic educator and cardiologist and dietitian knowledge into the system that can automatically provide advice to the person. And only in rare cases, the person will need to talk to the cardiologist if her particular case is a bit of an outlier and it's not part of the model. That can dramatically speed up the way of providing care and advice to the patient, because the patient is anywhere wearing a shirt. That's seamless. And the third thing is, by doing that, you can treat many more patients at very large distances. And 5G and 4G technologies will enable that. That we are not totally crazy. Just sharing examples of two Canadian companies which are pushing this type of technology. One is Myant, the other company is Hexoskin, and both of them are trying to create technologies that you can wear at home for healthcare monitoring. What is important, these are the first products. This is the beginning of the whole industry, the beginning of the whole science. And I think this is just the tip of the iceberg of what is possible in this space. So as a result of that, we, in a partnership with Ryerson, with University of Toronto, with OCAD, and colleges like George Brown, Centennial, Humber, and my brain is having a moment. You'll see it in a second. We actually have created, Sharon, we have created actually a package in which we have a new project which is developing textile-based technologies. And I want to show you a little video which explains what we're trying to do. So this is what we're trying to accomplish. And, you know, you cannot do that without having a critical partner who steps in and nudges the whole system in the right direction. And we were very lucky that Lucky essentially brought the partner that I would like to tell you about. So this is our new partner that we are going to develop research and development and commercialization of fabric-based technologies. That's a SONA College of Technology and SONA Group, and also their V Technologies group. They're part of the same structure. The visionary behind that is Choco Valiappa. He's going to give a lecture tomorrow, so I kindly invite you to listen to him. I think he will have some exciting thoughts to share with you. We met about 2 years ago, I think it's 2019, in Toronto and then later in Berlin. And we both thought that this fiber project would be a great thing to do. He saw that we were trying to build the facilities along these lines, and Choco came forward with this partnership between V Technology, Sona Group, and us to create a new program for designing new technologies in this space, which are which are for medical applications. He has an excellent team of people, which Krish, Suri, and Nirmalash, who worked with us closely for about a year to go from beginning to creating a contracts and creating a program. The program has been launched about 2 weeks ago, and we expect the first grants and first projects to start in September this year. This is an outstanding team, and this partnership with Sona and with Technologies has really made a huge difference for Kite, and we're very appreciative of that. The other clinical partner that partnership that we had created is actually with Medanta hospital system. Lead, of course, is Dr. Naresh Trehan. Dr. Trehan is going to also talk tomorrow, so I would like to encourage you to listen to his presentation. What we have been trying to do is to simultaneously work together on a clinical practice and doing research. And as a first step, his team, Dr. Sharma, Dr. Singh, and Dr. Manamela, we are all working together and with Dr. Bailey, who is also talking tomorrow, to create a program for rehab in stroke, spinal cord injury, traumatic brain injury, and cardio rehab. And we are working together as they're building this rehab program in Vedanta. We're trying to provide them with the knowledge and expertise that we have so they can combine with their knowledge and expertise to create the most attractive rehab program in their setting. And once that is in place, then we will start working on creating research opportunities and working together. We have some other projects in the pipeline. We're working with Apollo right now and Raul Reddy, but that's for the next time when we present the status of our partnerships with India. These things don't happen without somebody who is supporting this strongly. And our two guardian angels have been, of course, lucky Dr. Lakshmanan, who has been working with us closely for many years. And all these connections and partnerships have been enabled by him. And I'm personally very grateful to Lucky and my institution as well. And you will see tomorrow about the endowment, which is a huge boost for our team and our institution. And we're extremely grateful for that. The second guardian angel has been Consul General, Ms. Apurva Srivastava, has been in every single meeting, and she was always pushing us and asking when this memorandum is going to be done, when you're going to start. And she was a force of nature that we extremely are appreciative of, and she made many of these projects move faster and with more force than we originally expected them to happen. So I'm very grateful to Apurva. We at Kite and UHM believe that this partnership with India is essential. I think this is where we should be going. And as many people will say, these two democracies work very nicely together. We, from the Kite perspective, have been enjoying this process. It's been absolutely outstanding and wonderful. And I think that's just the beginning of very nice growth and expansion of the programs we'll have with India. And thank you for giving me an opportunity to share these exciting developments on our side.
Thank you very much, Milosh. Thanks for all the good work you are doing. At the end of the day, Milosh, as you recognize, it's people who make things happen. And we are fortunate and have the privilege that we're able to work with the best of the best with you, UHN, and Kite. Years of working together, and the journey has begun. We have a long way to go working together, reaching out the answers for the community members. And Canada and India coming together with your leadership and members like Choco and Dr. Naresh Trehan, I think we'll have many, many good results to come to solve the issues, challenges for the global population. Thank you, Milosh. And I really enjoy working with you, not alone as a true Canadian, but also someone who has such deep relationship with my Matrabhumi in India. And people like you make us feel proud that irrespective of where you live, we all serve the same human population. Thank you, Milosh. Keep doing the good work. We'll all be there together to serve you. Thank you very much, Milosh. God bless.
Thank you, Lucky. Thank you very much. Very kind.
Friends, now we will move into the breakout session, and kindly join us at 12:45 when Professor Arun Chokkalingam and I will join for the concluding remarks. So kindly go and join your breakout sessions, and we'll meet together at 12:45. We are running a few minutes late. Please bear with us and come and join at 12:45. Thank you very much for being with us together in this morning. Thank you.